class, I'm going to be demonstrating an assessment on a postpartum mom. You are going to be responsible for understanding and knowing this material when you come to the OB clinical. So this recording will be placed on D2L, so you can watch it as often as you would like, so that you can become proficient with the information. So, of course, you enter your patient's room by knocking on the door, introducing yourself, washing your hands. Good morning, or good afternoon. My name is Nancy Eaton. I'm going to be your nurse caring for you today.
Hello, how are you?
Okay, how you been doing?
Okay.
Yeah?
A little bit sore.
A little bit
but
sore?
I'm doing okay.
Okay, well I'm going to be checking over that and seeing how you're doing. First off, I would like you to give me your full name and your birthday, please.
Okay, my name is Beverly Johansson, and my date of birth is May 12th of 1985.
Okay, and do you have any allergies to any medication or food?
Not that I'm aware of.
Not that you're aware of. Great, super. Okay. So when you come in the room, typically, just like we do for all of our patients, we're going to introduce ourselves, wash our hands, and two identifiers, name and date of birth. And of course, we want to check allergies. So I hear you've had a little baby girl this morning. How's she doing?
She's so beautiful. Her name is Hannah Rose, and I'm so excited to have her.
I know. Is this
scared, but excited.
It is different. Your life changes. Is this your first?
Yes, she is.
All right. Oh, well, you're in store for a lot of wonderful blessings, but lots of new things happening in your life over the next months and years. Yeah. So I'm going to start. When we do a postpartum assessment, we use the acronym BUBBLE-P. Okay. The first B stands for breast. U stands for uterus. This next B is bladder. The next one is bowel. L is for lochia. E is for episiotomy. H is for Homan sign, and the last E stands for emotions. And we're going to go through each one of those, and I'll be stopping and starting and conversing with our patient today to help you understand maybe some of the responses that you may receive. Now, with any assessment, you still want to listen to heart and lungs. With our OB patients, these are typically healthy women, okay? And so we don't need to look in the eyes and the ears and the nose and the mouth, typically, okay? There may be some circumstances that we do, but we'll talk about those in a different recording. But we do want to ask her, of course, is she in any pain? So, Ms. Johansson, are you in any pain this morning?
Probably more sore than in pain.
Okay. Where is that soreness located?
Yeah, wherever I had the baby. I had a little bit of an episiotomy.
Okay. All right.
So it just kind of sore a little bit.
Sore. All right. On a scale of 0 to 10, 10 being the worst soreness or pain, how would you rate your pain?
It's probably a 2 or 3. Probably about a 2.
Okay. Is that tolerable to you?
Yes, it is.
Okay. All right. So, we want to know what where the pain is, what the pain scale or pain level is. Is it tolerable? Is she in need of any medication? And, of course, we want to know when her last pain medication was given so we know if we can medicate her if she needs it. All right. Ms. Johansson, I'm going to first start checking you over to make sure everything's going well for you. And we always start with the breast. And I want to know from you, are you having any pain, tenderness, soreness in your breast?
No, not right now. They feel a little swollen.
Okay, all right. That's not unusual. Have you had any leakage from your breast?
Just a little bit of clear.
A little bit of clear, okay. And that is what we call colostrum. It's kind of a clear yellow discharge, and that's the precursor to your breast milk. Now, are you planning to breastfeed?
Yes, I am.
Okay, super. That's wonderful, and we want to make sure you're feeding your little one at least every 2 to 3 hours, starting with 5 minutes on each side and increasing that as she is wanting to eat more, okay? Has the lactation consultant been in to visit with you yet?
Yes, the second time I breastfed her,
Okay.
she came in and it made it a lot better.
Super. They're wonderful, and they have a lot of resources, so they're a good resource for you to tap into even once you go home. So don't forget that. We'll make sure you have all those phone numbers. So just a little bit of fullness, feel like it's swelling, a little bit of leakage, any redness, lumps, bumps that you're feeling in your breast?
No.
Okay, great. So, you know, when you're doing an exam, we're not going to just strip this gown off this patient, okay, and take her bra off. We're going to ask her these questions. If she says no to lumps, bumps, redness, significant discomfort or pain, we're going to leave it as is, okay? If she describes any of those, we need to get either myself, you need to get either me or your primary nurse that's caring for that patient, so we can look at that breast and make sure there's not any concerns for infection or mastitis, which is what we would be concerned about. The other thing is we want to make sure that Ms. Johansson is wearing a bra, and she is. If she wasn't, we would encourage her. Whether she's breastfeeding or bottle feeding, we want her to wear a bra. The bra, again, supports the breast. It prevents a lot of extra stimulation that doesn't need to occur, and then it just makes the moms feel a little better when they're supported better, okay? All right, so now that we've talked about your breast, Ms. Johansson, we're going to check and see about how your uterus is and how it is in relation to your abdomen and how your bleeding's going, okay? So when you're checking the uterus, it's going to be hopefully in the mid-abdominal area, okay? I'm going to show you on this mannequin, and then I'm going to show you on this torso here in just a minute. You always want to inspect the abdomen, and even though the U is a second assessment within the bubble T assessment, I typically, before I start mashing on mom's belly, I am going to listen to her bowel sounds, just like we teach you in a med-surg patient. So I want to know when her last bowel movement was, and when was it, Ms. Johansson?
It was yesterday evening before I came into the hospital.
Okay, super. And that is not unusual. Most women will have, if they have it before, they're not going to have it hopefully during labor or delivery, and they're definitely not going to have it right after. Very seldom have I ever seen that. But we do want to know when the last bowel was. All right. Well, one thing I want to encourage you, Ms. Johansson, is that you drink plenty of fluids, and as much as you can, get up, move around, eat fruits and vegetables, because that fiber is going to help stimulate your bowel, and you're going to be able to go to the restroom a lot easier. We don't want a hard stool because that's going to be much more painful and difficult for you. And so water, ambulation, and fruits and vegetables. And we're also probably going to be giving you a stool softener since you are taking some pain medication also to keep that stool soft, okay? So you want to listen first, and then we're going to assess the fundus. The fundus, or the uterus, the fundus is the top of the uterus. And what we're checking for is how it is placed, or the placement within the abdomen. So here's my little pregnant, or my non-pregnant torso, my postpartum torso. And you see right here, this little bubble here, right? Okay. So when I'm assessing, and I want to put gloves on, okay, because I'm getting close to the area of where her discharge, her lochia, is occurring, and I do not want to contaminate myself, okay? Hand washing is vital, okay? It's like #1 importance when we're caring for postpartum moms and babies. So I'm looking at her abdomen, I've inspected it, I've listened to her bowel sounds, and then when I'm wanting to see what how the uterus is in the abdomen, I'm going to put one hand along the symphysis pubis, along the pubic bone, okay, to give it added support. I'm going to take my other hand and I'm going to kind of walk down my fingers until I feel the top of the uterus, which is the fundus, okay? And the way we measure this is the relationship of the fundus in relation